Well, my name is Dr. James Vincent, and I'm one of the ER physicians here at Elite Care. So I would consider myself definitely a Texas boy, and I moved to Galveston in 1996 to go to medical school at UTMB. And then from there, at medical school, I met my wife, and so she was an OB-GYN resident at UTMB. And I moved to UT Houston in the Med Center to do my ER training. And I'm kind of a unique guy. I did extra training in pediatric emergency medicine at Texas Children's. And I finished up, when was that? 2006. So I've been doing ER, pediatric ER for quite a while now. We were here during Ike. I was part of a project at Clear Lake Regional where I helped them build and kind of staff and set up a pediatric ER. And it occurred right after Ike. Literally, like right after Ike, they realized they had this name. So I have a lot of experience in, pediatric emergency. I would consider myself a family man. I have 3 lovely children and, all local schools. So we live in League City. We actually live almost to Friendswood in League City. So I have 2 teenagers, a senior and a junior. They're both at Clear Springs. So we love the AV department there, and my kids are getting ready for college. And then we have a little guy too. He's 9. He's at Bay Area Christian. He's in 4th grade. So we definitely cross paths with a lot of people that we see here at Elite Care because we're just right in the middle of where all the action is. So emergency medicine is real unique because, of course you see people in kind of their moment of greatest need. And I realize I'm actually not one of these like kind of adrenaline seekers that you might see on TV where you're like, you love the crazy cases. I found I really actually liked kind of bringing a sense of calm or like a sense of peace to people's situation. I found I really became good at that, especially with parents with their injured or sick children. Very stressful for a parent. So I think that comes through. What's really nice about emergency medicine, especially pediatric emergency medicine, is that our science is really based upon kind of reassuring parents either through maybe testing or some imaging that your child is going to be fine. And then for those rare serious injuries, or illness, we're also able to pick those up as well. So I'm real happy to bring my expertise here to Elite Care because it's just a nice place to work. I've worked at many big hospitals, children's hospitals, the big, community hospital, and I just love the flavor here because we do have a little more time to spend with parents and patients. I care about my family, and my favorite way to practice medicine is as if I were caring for one of my own, my sister or one of her kids. And I know Elite Care allows me to practice that way.